the patients in this room, all the feet that you see, they all have COVID.
It was just an overwhelming surge, and they kept coming in.
Listening to those cries of people just saying, oh my God, I hope I don't have COVID, and then you hear that they're not here anymore.
Worried about my patients, worried about myself, and worried about the world and how we were trying to battle.
In the beginning, we were just flying by the seat of our pants. The community was very, afraid.
If you watch a war movie and you see people shooting from all over, that's what this almost felt like. One thing after the next, you can't even catch up.
I saw people coming in crying because their loved ones were in the ED, trying to, figure out what was happening to them.
There were times that I actually broke down after assessing patients because I can hear the fear. I can hear the sadness in their voices when they would talk to me. I've had patients tell me, please make sure that I live.
The morgue was full. They actually had bodies in a large storage area. That's how bad it was. We were up to 230% above what our normal medicine kind of capacity is. Every other service was shut down.
Seeing the doctors running from room to room, taking care of patients, knowing that possibly they're not going to be here for very long.
Having to speak with family members when their loved one passed away to give them grief counseling. That was hard. That was really hard.
I was here at 9/11, and I was here in Hurricane Sandy and the 1993 World Trade Center bombing, but this was different. It was kind of sustained. So I think it drains you, and you feel drained. It's changed. I think it's led to a little bit of almost like a PTSD feeling.
I remember just coming in and just sitting in the parking lot for a little bit to just catch a breath, to just prepare myself to come inside.
This has affected me emotionally because I see how serious this disease is and how many people have lost their lives to it. That's going to always stay in my head. It will never leave.
We've lost a lot of people that we loved really dearly, a couple of nurses from the ED and the units. I mean, these people we see every day, and these people are family to us. I've learned that this community is resilient. You have to be grateful for everything you have because it could be taken away so quickly.
To see the resilience of staff and patients, the outpouring support was great from the community. The one thing I can say I took away from this pandemic is that we as humans can come together to help each other.